Rising cases of COVID in Moffat County is definitely becoming a concern, primarily because our vaccination rates are a little bit lower than the rest of the state and some of the rest of the country. Over this past year, we've tracked the number of tests that we have performed both here and in the clinics, as well as in the rapid care, pretty much all of our testing. And we've had a fairly steady rate. There have been some spikes here and there where the positivity rate has increased. But for the most part, around winter, from December through February or March, those numbers have gone down a good bit, partially due to vaccinations that were coming on. Unfortunately, those numbers are starting to go up. We were averaging about 6 or 7 positive cases out of every 50. And now just in this past month in May and beginning to happen in June, as we're seeing that number almost triple and quadruple up to 20 per 50, which is a significant increase. What we're finding is as the regulations are being dropped and mask wearing is dropped and there's more public gatherings, the significant unvaccinated population is at risk. Nationwide, we're seeing increasing rates and also severity of illness in people like adolescents and young adults. Even though a significant portion of the population has received a vaccine, it's not too late to consider getting one again. The reason it's important is not just for the individual, but also for that of the greater community. Herd immunity is definitely a scientific entity in which once you reach about 70% statistically, the ability of the virus to spread is significantly diminished because it just doesn't have that many susceptible hosts. One of the things that we are at risk for here in Moffat County, because our vaccination rates aren't where we would like it to be, we do find that the rest of the community is susceptible to having the spread of the virus, and not just the virus itself, but all of the multiple new strains that have developed that we may have heard about. And so these new strains that do develop can be more virulent, meaning more stronger. They can be more easily spread and more contagious. And the problem is that the more times that people get the illness, it gives the virus more chances to replicate and to develop new strains and to mutate and become different. If the person's immune system fights it off and the virus can't replicate, well, then it can't mutate and develop new strains. And so by reaching that 70% goal, it isn't arbitrary. It isn't just a number that somebody picked out of the air. It is a scientific statistic fact that if we can get our community and our country, for that matter, to that point, it will limit the spread of the virus, limit the threat to everybody. And so that's really one of the big goals that we do have. Well, in closing, I definitely want to thank everybody that has gotten a vaccine, everyone that has encouraged their neighbors and friends and family to get vaccinated. We have done a great job. I think that Memorial Regional Health has been a great leader in this community in getting the vaccinations out, whether it be via mass vaccination clinics or in the personal provider clinics, in the emergency department. There are multiple routes and avenues to get vaccinations available. We are offering them in the emergency department to our patients. We're offering them through the clinics. And so if you are interested, it's definitely not too late, and please consider getting one. I definitely appreciate everybody's effort in this capacity, and I know everyone is sick of hearing about it. We all want to go back to our normal lives, and this is definitely the quickest way to do that. But I do appreciate everyone's sacrifice and all the contributions that we've made to this point.